right. Well, thanks for our chief party maker, Amanda Tweetin, and all the updates and fun she keeps bringing. How did her last hour go with reading from Little Women? I didn't get to see any of it. Did it go well?
Howard and I might have made a few people have to go to sleep because we.
Well, that's a good thing, right? It's melodic.
To read people to sleep? I don't know.
Well, let's see if I can do any better keeping people awake during this call. Welcome to all the residents and staff, and this time around we have even family members from home signing in, and we're going to be recording this conversation, which it is already started. We've already started our recording, so your shining faces may be a part of our online recording here. So just heads up on that. And if you have any questions that you want to ask, feel free to go into the chat section, and I'm going to do it right. I'm going to do it right now and say, ask questions here. So I'm opening up the chat group so everybody can see that. If you have any questions, please feel free to put it in queue. And Shannon, who's going to be, want to wave to everybody. Shannon's going to be helping to keep on top. We had some questions from people who could not attend, who gave us the questions in advance and said, please cover these topics. So we're going to cover, I think we've got about a half a dozen questions there to cover. And then anything else. So if you got questions, put Troy at Boulevard St. Charles to work. Make him type the question in there so we can get that answered. And anyone, and there's Rachel. We need to put Rachel to work too. Hey, Rachel. Rachel's done an awesome job with her social media. It's been fun to watch. It's such a crazy time. It has been so much fun to see the photos, the videos, and it has been across the board. So thank you, everybody, for continuing to show what senior living is really about. And especially to be able to send out these messages to families, since we can't be in the same kind of contact in the same room like we once were. This is a great way to stay connected beyond just making telephone calls. So that has been a delight to watch. Can everyone hear me okay? Can you thumbs up if you can hear me? We're doing pretty well here, looks like it, because we had a comment earlier that audio was not good, but it got better. So hopefully that means we are still there. Also, if you are signed in from home, you were put on mute. If you could stay on mute, just because the sound everyone would hear. And I saw a social media video that one of our regional operations directors shared from Zoom, and I have to tell the story. It was somebody who's not used to doing video conference. It's not the easiest to do. They were doing a call from home for work, and they took the computer to the bathroom. Well, guess what? It's a video call. So hopefully I'm not going to lose your attention so much there, but it does give feedback when you're not on mute. So if you could stay on mute. I love seeing your smiling faces. It's fun to see
on
that.
mute, I guess, isn't it?
Yeah, we've got the Fergusons joining us here. Got that, Cassie. We're good. Cassie, our VP of Sales, is who's also done a recent video you've probably seen, is going to be helping us mine the keeping the sound so that we can make this as peaceful as possible and be able to hear each other very well. So we've got over 100 logins on this call at once, and if you can tell, we've got quite a few people at some of these logins. So I'm sure we have several hundred people already listening in at one time here, and people will be reviewing this call because of the recording. We're going to be posting it online on each of our property websites. At the very top of the website, we have a COVID-19 update. And in there, we're going to be linking any letter we send out, any update information that becomes available. We're going to post it to that page. So if you want to get a quick update and take a read of what is going on, feel free to stay on top of that website because not everybody has social media, Instagram or Facebook, but everybody would have access to the internet on our website to check on any critical updates. So we sent out a letter last week regarding social distancing. It's up there. Any of the videos of the events that we've been hosting, we've been loading those online as well. Okay. Cassie's keeping herself busy, I think, with all the sounds. There we go. All right. For whatever reason, it shuts me down, so I apologize in advance on that. All right. I have right now some good news to share. We have been going through, we're over a week now with the new precautions with the visitor restrictions in place. But many senior communities, there's various senior communities across the country who are reporting presumptive positive cases or COVID-19 positive cases. As of today, we have no positive cases of COVID-19 in our communities, and we want to keep it that way. So some of the things we're doing may feel aggressive, overreactive. I learned from a mentor many years ago, everything worth doing is worth overdoing. And right now, to protect the lives of our residents, our employees, and others, we feel that what we are doing is necessary. And I believe we are in the process of, I kind of think this weekend was sort of the eye of the storm. I heard the Surgeon General today on the news report saying that this next week could be the worst because there's a lot of testing is out and more widely being done. So we're presumably going to have more positives across the country because we're doing more testing. So I think we're going to find, and it's going to be scary to hear this, as the numbers double day to day to day. And that's what we've been experiencing in many of the markets where our communities are located. That the risk is probably no different than it was necessarily the week before, but the cases are coming out where we're hearing the news, and that's where the fear can certainly settle in. We are going to continue to follow the process of the 4 levels that we talked about in our last week's call. So and all of our communities are still on an at-risk, just staying on guard level or lower. We do not have any known positive tests in our communities, and we want to keep it that way. And we're going to do what we need to do until we understand what is the best practices. We're going to continue to follow what CDC is giving us as guidelines, as well as the states and the local health departments are also giving us quite a bit of direction because they know that we stand in support of the generation most at risk with COVID-19. So we will continue to keep you updated. If anyone individually were to be exposed from a presumptive exposure or to a known exposure, families would be made aware of, residents would be made aware of. We would treat it like we would if there was any incident. So that means we're reporting to the family, the residents, the physicians, and we are taking then guidance from the county health department, from the state health department. That is the protocol we have in place, and we would activate that if we fell into that risk category. So I wanted to give you some positive news, but I also want to warn what we have going on in the next 7 days are going to be critical, that we stay diligent in sticking with the communities that are social distancing. You'll see several of them across the cameras. There are other communities where residents are dialing in by their own apartment because we're taking precautions at that community, that we are going to continue with those protocols and monitoring that. And we're going to get through the next week. Our staff, talk about the heroes. We have been able, we walked into this in a healthcare worker shortage in this industry. And, we still continue to need more help. We've pushed out a universal support partner position to try to attract people from retail and restaurants who are out of work. come on board, help us, because we've got to continue business as usual to meet the needs of our residents. And our workers are carved out as a special category of essential workers. And I watched this morning a news report that I watched related to, I'm one of those monitor the traffic scanner kind of person. So I was watching a news report of this gentleman going to work this morning in a county where they had, it was in St. Louis County, where there is now a lockdown or shelter in place process in place. And the roads, he said, this is pretty much a normal traffic day. So I guess a lot of people think they're essential. But we could stand to use more, we need help. So if you know somebody who's out of work, please have them apply on our websites. We have this kind of utilitarian, utility position opened up, this universal support partner position. They can certainly apply for that, or any open position that we have that matches their skill sets. But we certainly, as you're talking to folks, and I say this to residents, you've probably got family members who are out of work. You've got friends who have folks who are out of work in their family. Help us as we try to reach out to others and get these positions filled. But those heroes that I was talking about, our employees, they have continued to show up. And you see people saying how, they're healthcare workers. I'm not getting time off right now. I'm not getting the next 2-3 weeks or whatever it is off that they're showing up to work. Our staff have been absolutely incredible. And I am so proud at a level that I can't even hardly put into words before I might begin to ugly cry, as Amanda always says about me. We have an incredible group of people. And I just want to take a minute, and we may be silent, but I want you to give the folks in the room that are showing up every day and have been there for you, for us, for me, for you, for your family members. We owe them a round of applause. Let's take a minute and let's thank them for what they've done. It's pretty incredible when you think about this. They've left their families at risk, and they're showing up every day. And I please know from the bottom of my heart how grateful I am for what you continue to do on our behalf every single day. And we're looking to recruit a few more heroes like that to join the teams and to help us, because the responsibilities have become much different than normal. It's very different when you're serving residents in a dining room and you've got 3 or 4 people sitting at a table, and now you might only have one person sitting at this table and then one at that table and one at that table, or no one is sitting at tables because everybody's getting room service or takeout. That adds so much more responsibility on the team and so much more efforts on their behalf. And our care team are taking temperatures each shift and are monitoring visitors that are coming in that are essential healthcare workers. And the extra protocols that we've put in place as a part of protections is putting a burden on them. And I just am so grateful for these heroes that are really continuing every single day to show up and fill our shifts. So thank you guys from the bottom of my heart. We are just a few more minutes of updates, and then I'll open up questions. We still are maintaining a multidisciplinary committee of folks from various service areas within our company, meeting on a daily basis to review any necessary questions we need to clarify that are related to a policy adjustment, addition, or if we need to clarify something in particular, or to answer a question that may fall outside of the policy. It's a gray area. It's a specific case or an item that needs to be addressed on a case-by-case basis. We continue to meet each day at 3 o'clock Central, 4 o'clock Eastern, and we're using that to funnel communication out to our staff for any changes or adjustments we're trying to make in this uncertain time. So we are going to continue to meet indefinitely on a daily basis to allow for this review and flow of communication. The other thing is that all of the communities continue to remain under a no visitor policy, and many of the states have already now established or local jurisdictions have established shelter in place or lockdowns. So as a result, our staff were provided letters or have letters available should anyone stop them for visiting that speaks that they work as an essential healthcare worker, and that's why they're on the road or commuting to their work. They're also asked to show their name badge if they didn't have their letter, or call the community for verification they're on the schedule. So we've put some protocols in place should we see a National Guard, lockdown of interstates and a more serious review. I wouldn't be surprised that, and I shared with you the story in St. Louis County where it was sort of traffic as usual, that we may see more and more clarity as to what an essential worker means. Ohio just rolled out a very specific list of what is essential. Under all circumstances, our communities will be considered essential workers because each of you that are living in our communities are dependent on it. If our teams don't show up, who would be there? So we will always be a carve out of the policies, but we may see a little tighter restrictions or a little clearer interpretations over that over the next a couple days. So we also are going to be working through some tweaks with our dining program. It has not been as smooth as we would love. The room service option, getting the food out, making sure the food stays warm and it's delivered on a timely basis. That's a challenge we're still going to work through. We're going to look at getting more hot carts for transports, obviously covers. We're going to have to look at ways to utilize China, because if you think about all of the restaurants now that are to take out only are using more disposable products than ever before. So a couple weeks ago, everybody was scrambling because they needed personal protective equipment or masks or gloves or various things to prepare for this crisis. And now we're down to making sure we have enough clamshell boxes and styrofoam boxes and takeout boxes to be prepared for all the disposables we're going to be using. So we're going to be looking at ways with some other tools where we can continue to use China where necessary. I know we have been using it where we can, but more to try to use as much China as we can, because we don't know how long we're going to need to be under these protocols. And we know we can chemically and with heat sanitize our China, and we'll take different precautions if a resident were being specifically quarantined or if a community was under a more stringent protocol. But the team shared with me this morning, I was meeting with the folks on our team who are accountable for ordering supplies. So Lacey Goins from our team is leading this charge with Judy Nobles, Rick Sackman, Derek Lowell, some of the key folks who represent various service areas that are helping to ensure we have product being delivered to our communities and continuing to get, if a building can't order in a normal channel, they're trying to find a new channel for us. And they shared with me this morning that at this rate we'll be burning through 5,000 boxes of styrofoam boxes a month. And that is just an unheard of amount of boxes. So we're going to prepare as such, but we're going to be looking at ways to reduce the use by some of this other equipment and some other modifications to the dining. I really appreciated some of the advanced questions, got us already kind of our wheels spinning and thinking of different things that we could consider in light of your comments, or ways that we could accommodate for some of the things you were suggesting, or just new considerations that got us thinking about. So I love the collaboration of the questions we're getting through the Facebook comments, and any of the correspondences that are occurring through social media, through the websites. I personally got routed an email from a family who was trying to get in touch with one of our communities because their mother's cell phone had charged down, and it got routed to me. So I handled it with the regional director. But we couldn't do what we're doing right now without that kind of communication. Unfortunately, we're having to rely upon these unusual channels, but I'm hopeful within it, we find new ways to communicate that make sense. In the last week, we've also rolled out a text messaging app. So anyone who is listed as the responsible party or an emergency contact, and we had a cell phone number as that contact, was able to receive a text message with an update when we sent out the letter, and to push them to see our website of any updates. So don't be alarmed if you get a text message coming in. We're sending it, under your through your executive director, and they can do some correspondence back. But also, a gentleman in our office, Bill Weissmiller, is continuing to help answer questions that pop up, especially if it's something that we know we can answer, and we don't need to specifically have that executive director respond to. He's been helping to try to field those responses. So let's work to try to get into one of those channels of communication that work for you. And if I said something that you have a cell phone number available and you want to be on the text, certainly reach out and let us know, and we'll get you added. You can feel free to direct message on Facebook, or call the community, give your cell phone contact information. But we certainly want to open the lines and explore what is the easiest way to communicate with you. I think that covers all of the general updates I wanted to provide. Shannon, let's start off with some of the questions from the outside. So you want to get that going? All right. So for those of us, this is the first question we received, one of the first questions we received. For those of us who don't have the ability to watch the video updates, could we get more posts about the steps being taken and what we can do to help? Okay, great. This is I wanted to point out, we do have on every one of our websites, all of the information we're sharing is up online and available to you. We also are using the video posts that we're doing. They're about a 1 minute. They're about a 1 minute video. We're using those as a quick way to try to distill the information. So if you have a minute to spare, that is the fastest, most efficient way for us to share the information. If you want a more in-depth, going online to our website, so you could go to arrowseniorliving.com, or any one of our property websites has this special tab, or special, I guess I'd call it tab or link across the top, that will give you all of the critical updates. It's got some of the videos, it's got the letters, it's got CDC guidelines, or any information that's relevant is up there, and you can go as detailed as you want to. But also for quick updates, the videos are another great way. They're also linked online and available on Facebook, are just quick 1 minute updates on something we're doing in a particular area that are available to you. Okay, Shannon, what's the next question? I'm just apprehensive about the screening protocol for employees and outside vendors, as they could be bringing infection into isolated residents. Okay, excellent. Great question. We are screening all visitors. That would mean only essential healthcare visitors. So for example, if a resident was receiving hospice care or home health or therapy, those visits would continue because they're essential to that resident's care. If it was something elective, or it was, nobody's coming into the communities providing Botox injections right now. How about that's a great example. What I could say is not essential healthcare at this time. But anyone who's receiving home care, hospice care, therapy are continuing. But those individuals are going through a screening process, both of we take their temperatures as well as they complete a questionnaire. We have been updating that questionnaire as new questions emerge that are important for us to be tracking. The basics on there are tracking symptoms, but now we're also tracking travel, domestic travel as well as international. And we are actively exploring how we can track if anyone has visited another healthcare facility, because I do believe that is one of the #1 risks. And I have a gentleman right now on the phone actively working through with counsel, can we add that question to our questionnaire? Because I do believe that is the bigger risk. The great news is Most of our communities have preferred providers, where when we have somebody visiting the community, it's most likely somebody, because they have so many clients at our community, they're the only one that visits our communities, or that is their only job. For example, I was on the phone this morning and again right before this call with Premier Home Health. They are our preferred home health provider at our Boulevard St. Charles, Boulevard Wentzville location. And I was talking to him about, could your therapist help us work with residents who are now in their rooms and not walking, and in their apartments and not walking as much as they once did. Like, how do we keep them, what are tips and trades tips that they could be doing, or can therapy be opened up? And what I found out, they have a dedicated therapist for us at our communities. So they're not going anywhere else. They're not going to anyone's homes. They're not going to other communities. So we know that how we're operating is the exposure they would have if they were in any healthcare community. So it's nice to know that that assurance. So we have that relationship with, I'll just name quickly, Fox Therapy or At Home, like those other groups exist. Those relationships exist at each location, so that we can know that that person isn't potentially going into the home or to an apartment or in another facility where somebody may be may have tested positive, or maybe a presumptive positive. So they're going to begin what Ann wanted me to share, and I'm assuming this is the case for all home health. If there is a concern, they're more than willing to do a screening and a review to look at, does this person qualify under Medicare, and would there be a good protocol that would make sense. So feel free to reach out, or we're going to work through some more pronounced channels and how you can reach out. But in any normal day, you would be reaching out through the wellness team to help establish that line of communication, and they would do a call or do a visit to make that assessment. So I do think we're going to have to tap into the resources we can, that we know are under a level of control like that, to help us all stay moving when we've really restricted the number of square feet we have access to. So we all could stand to learn that, and join Michelle's classes in the morning. She'll have you punching and kicking and doing things you need to do to stay keep burning some calories and keep your body moving. So that is available, I believe, every morning. Is the Michelle's doing her class, and she's a certified Pilates instructor and certified in a million other things. So I'll leave it at that. And she works for the company and is doing this doing these visits in the morning on our virtual event calendar. Okay, so let's go on to the next question. And one other thing I wanted to say, we've also added our independent living communities. We've added another option where residents, because they're independent living, our assisted living residents are being screened, and our memory care residents are being screened for temperature symptoms more frequently. For our residents in an independent living, we have opened hours or time periods where they can go for screening if they wanted their temperature to be taken, and go through the questionnaire and have kind of somebody to just do a symptoms review with them. So that also got rolled out last week in addition. So had they been leaving the building for a necessary essential healthcare visit, they would have had that protocol when they returned. But just from day to day, they're going up the elevator to their apartment and down the elevator, they not have been around anybody, but they may want to have somebody helping them monitor for symptoms. So we're taking that extra protocol, or offering that additionally. Shannon, now I'm going to go back to you there. Sorry. As the weather gets nicer, is there a system in place to allow residents to go outside to get fresh air and sunshine? This question comes in from a family member in assisted living, and our independent living residents are probably very much enjoying their patios and balconies, and encouraging that. I don't know if some of you saw the video that went out a couple of our Springfield locations this weekend had an opera singer singing outside, and residents were coming out on the balcony watching the singer. So we had yesterday was a pretty rough day in my town. We had snow on the ground for March 22nd, having snow on the ground, but weather's going to be better this week. So I met with Kayla Barlow, our regional director of resident services, this morning, and she's going to be working with each building to make sure that we have hours set up for the residents who don't have access to their own balcony or their own patio, making sure they can have access to the outdoor areas that exist all throughout our community. We have access points, but we can set up programs to make sure that somebody could be escorted to the area, to make sure that we don't have more than one resident around, or putting the proper controls for that community, the design of that community, and for any specific risk level that we have. So if a community is still doing group activities with social distancing, we can have a couple folks at a time. It's not limited to one per apartment, but those where we are taking extra precautions, she's going to be working to refine to make sure that everyone is offered and given the opportunities to get some fresh air, because we've got some better days ahead. And that was a great question, making sure that the group of folks living in assisted living, that they too, if they don't have access to a courtyard, or they don't have their own balcony or patio, that we can figure out some other solutions and communicate directly with them. That was a great question. Shannon, I'm ready for the next one. Okay, regarding personal tasks that we perform for our loved one, do we need to ask the staff to manage those things, or are we allowed to visit occasionally if we're screened upon entering and wear gloves and a mask during our visit? So we are under a no visitor restriction, and most states have gone to specifically say even family visits would not be considered essential visits. So the answer to the question, in short, is you would need to make arrangements to have something delivered. If that's an errand or a support service you provide, you can certainly have those items delivered to our community, and we can get them to your loved one, your family member. Or if it's something that we can do, we have a wide range of optional services, or we could add something to our care plan if it is something that you were doing that was of a personal service or some kind of assistance with personal care. But you're more than welcome to continue to deliver items to the community through our single point of entry, and we will get those items to your family members. But we are under a visitor restriction, so we would need to assist you in that service. Now, Shannon, was that the last question, or is there one more on the pre-entry or the online team?
Actually, two more now about
okay.
that related.
All right. And I'm going to answer one online here while she pulls that open. What does essential doctor's appointments mean? So essential doctor's appointment is, so Botox injections would not be essential, but say that you had a follow-up appointment for specific treatment that you were receiving, that may be deemed essential. But the great thing is most physician offices have helped make that determination for you and have stopped all inessential visits. So if it is elective by nature, they're most likely canceling your appointment, or we would encourage you to cancel your appointment. The great thing is a lot of providers are activating telehealth options. So I know that At Home Medical, that does a lot of our they provide a lot of our physician services for our communities in Ohio, did a preview of their telehealth platform this morning with a couple folks from our leadership team in Ohio. And I also know that Anthem, our carrier for our employees, just gave us updated information on the telehealth program that they offer. So my guess is that each of your physicians may be able to direct you to that if it was a virtual screening or a virtual visit would be appropriate. Or if it's an inessential visit, they may be delaying it and helping you make that determination. So it's not as black and white clear as, you know, the Botox versus follow-up to maybe say cancer treatment. That's pretty clear, and the other one's pretty clear. It may be in a gray area. If your physician hasn't already canceled it, we can certainly talk through on a case-by-case basis to answer that question. Okay, Shannon, I took a lot of time there, didn't I? Okay, will the community assist in setting up telehealth appointments for routine visits? If so, can I be included? So yes, we're trying to set that up. For sure in Ohio, we have a single vehicle to do so, but we are going to be actively pursuing these options because I think we're going to find it's going to be a more dominant way that healthcare services are delivered today. It'll probably replace a lot of urgent care visits, or a lot of emergency visits will be replaced with virtual screenings as much as possible. And we can certainly help direct where we know through our existing providers, or help you assess what may be available. But the easiest way to do it is to check with your insurance. Your supplemental may have a specific process, or your physician practice may have a specific process. So if those two can't be clear, we certainly could help identify if there is another option that can be made available to you. So there's even third-party options that are national, or that are able to do it, that are we haven't necessarily used as like a on-site provider, but does provide these types of telehealth visit services. All right, Shannon, was there one more on that side?
Last question.
Okay, does the room service menu include simple snack options like cheese and crackers, a piece of fruit, or a cup of yogurt? If not, are those options available? So this was an example where we spent a lot of time this morning talking through ways to try to make the dining process a little smoother, a little more simplified. So one of the things we're going to be looking at is, up to this point, we rolled out a menu that was suggested during this time, but we have given some flexibilities on how communities respond. We have seen some communities really succeed in certain practices that we're going to look at rolling out more universally, because it's gone smoother, it's gone a little bit better, a little bit clearer. One of the things we're going to look at doing is having specific snack carts that may have intervals in between meals, so somebody could graze as well as eat. They'd have an option to maybe eat a hot or a cold entree for lunch or dinner, but in between would have had at least a snack option, and one later in the day, so that we can make these available on a roving basis, or more frequent basis. So it's kind of a modified response. That question got us thinking that we could be using that to supplement the gaps in dining, because many of our residents took advantage of the bistro offerings that we had, or in the country kitchen, the snacks that we made available. And we want to make sure we can continue to make that accessible from door to door as another solution. And we'll look at the practicality of incorporating it even into the meal to the meal options, but at a minimum, giving it as an addition in between meals. Okay, Shannon, was that it?
That was it for the slides. We had a couple more come in on the chat.
Okay, I can run on that now. Stephanie, what I call Spectrum, and asked them to upgrade one level for 3 months for free. So we have different internet providers at each of the communities, and we will look at, we actually can kind of tell bandwidth use and needs. Obviously, it's certainly gone up because of how much we're doing with virtual events. But we certainly will explore with the various providers we have what options may be available. We had a family member come to our building over the weekend. What should we do to prevent angering them if it becomes a problem? Okay, so certainly reach out to us. You know, that we have the one door entrance, we've got signage up, but sometimes, you know, people are still not seeing the signage, or, you know, thinking that sign that says all doesn't mean them. So that is happening in some cases, but please reach out to us. We take this very seriously, that the visitor restriction policy, unfortunately, is both ways, in and out. So we're asking residents to stay in, and we're restricting visitors from coming in unless they meet that essential healthcare provider exception. Please lean on us. It is our job to help and support this. But we've appreciated the multiple sets of eyes and ears in helping us enforce this, because you know, the last thing we need is somebody who broke a rule causing a risk, and we want to be able to any information you can provide in helping us, we absolutely welcome. Is there a psychiatrist available for the memory care communities in Wentzville? How about a regular doctor visit like a primary care physician? So yes, we do have visiting physicians, or a couple physicians that have the majority of our caseloads, who have put other precautions in place. I'm not sure specifically at Wentzville who they are or what may be available, but I'm going to take that question offline to Brenda, our regional wellness director, to make sure that she and Cindy, the executive director, and Sophie, the wellness director, can help us answer that specific question for you. But also Premier Home Health may have additional services and access to resources that I know provide services at the Wentzville location. A lot of seniors simply make a meal out of popcorn. So yeah, that's a great comment, and we can certainly get that available. We've got popcorn makers at every building. I think unfortunately we've had some emergency over the years. Probably the only reason why we've ever had to bring the fire department out for the smoke alarms going off, and when it wasn't some faulty alarm situation, was popcorn in a microwave. So we know popcorn we're all big fans of popcorn, but we'll make that available. It's a specific thought we've had about incorporating into the snack carts, and we can certainly look at how we can make that more readily available. And then Sheila is posting a question, looks like from the folks at Cedar Trails. Each day I have a cart tour the hallways with fresh fruit, popcorn and soda cart, hot chocolate, hot tea cart, happy hour cart, a yogurt cereal bar. Those are some of the ideas she's sharing across. Our resident services teams have been maintaining a group share through text of ideas. So it's been neat to see what each of them are doing, different variations. But thank you, Sheila, for sharing those specific ideas. Does anyone else have questions they want to post to the online chat? All right. Without any questions, I think I'll do a little wrap up here. Rachel, is there anything you want to say?
He was asking what happens if the Social Security and pensions get pushed back with rent. Like, will anything happen if they can't pay their rent because of that? Yeah. So.
Yeah. So at this time, there's no indication on that. I know we've had an extension on the taxes that we won't be paying. We don't have, our filing deadline has been extended from April until July 15th. So at this point, we're not under that risk. And I would say that, especially with the senior crowd, you think about somebody living at home right now as a senior, they may be paying people to get groceries for them or run errands. I think we'd find that it's one of the last resorts that there'd be any impact on Social Security payments. That would be a just sort of bad policy. I'd find that one. I would find it hard that would be the case. We'd probably be in a pretty desperate state if that's the case, and would have a lot more considerations. But we should find that when it comes to bill pays from checks being cut. Banks are trying to keep business as usual. That we should see federal government, again, too, trying to, it's sort of the power of the federal government behind it. If we don't pay, those checks don't come out on time, what does that say about the business as usual as they're trying to portray during this time to keep the economy together? So I would expect it to be okay. And if we got to that point, if we cross that bridge, we will get to it and we will work through it. But I'm confident that as of now, we're not going to see a delay. And it's one of the things that we've got to make sure. Our ask of you is rent continues on time, because we're still paying our employees. In fact, our employee costs have gone up tremendously because of overtime to fill positions. And so we're closely monitoring that as well, just as much as we know you've got to get paid, and we need to be paid as well to make sure that we sustain. And I believe we'll have the support of the government in that, and we should be in good shape. But if we cross that bridge, we'll get there together and we'll work through it. Okay. Any other questions?
Hey, Steph, it's Amanda. You did have one other
Yes.
person post.
Okay.
Westlake mentioned that there are several residents that would like to help staff by volunteering to do different things. What's your thought on that?
Yeah, I think we can accept some volunteers. It may not be resident to resident interaction support, but there's a lot of things that we're doing that is away from other residents, or we can contain risk. So this is one of those things on a case-by-case basis. We may be able to identify ways for residents to support residents, and be able to support in the effort. So certainly we'll explore those opportunities, but most likely it would not be direct person-to-person engagement, because that could create a risk. But if it's something like a project that could be done spaced out correctly and goes into the stream of another project, or ultimately gets to the residents, we may be able to do that safely, and we would embrace those opportunities where they exist. Some of my favorite things to do, I love when I go to the Fremont and see residents, at the Independent Living Lodge, they have a volunteer program that covers the desk at that community. It's so heartwarming to see that. So we want to continue to explore ways that life can be just as fulfilling and meaningful and normal as possible. And so if volunteering is a part of that and something you want to do, we would embrace exploring those possibilities. Events programming may be one other area that residents could support. We've got a lot of talent, and I know we're going to begin incorporating this week some of that talent into our virtual programming, but maybe that resident could lead an event in a hallway, or lead some type of effort for resident services. So I think, Amanda, it'd be great if the resident services team could explore how each building is utilizing volunteer support that keeps it safe. Any
Those
other
are
questions?
great ideas, Stephanie. And I would like to report that you've only touched your face twice during this call. I know, but just a gentle reminder that we have to wash our hands and not touch our face or other people.
But I have to commend you, Amanda, for your pure accountability for holding me to a standard, because she is correct. That is the safest way. Wash your hands. Don't touch your face. So we all need reminders of it. Dustin, you just touched your face.
No, it's funny. There's so many people. I mean, it's a natural thing to do. I catch myself doing it all the time.
Yep. All right. I was talking to somebody just before this call, and they said, we're going to be studying this time in healthcare history, or just in general, because we've learned so many things, or there's so many lessons to be learned by this experience. And I could tell you, there's things that we've learned that, this has been, I don't want to say I want to ever repeat this time, but it has taught us some things that are going to make us even better at what we do. And so I'm grateful for that opportunity. And I said to Amanda a million times, I am so grateful right now, so thankful right now that we have to be busy, because there are many people without jobs right now. and without that are isolated in their homes and not around loved ones. We do have a lot to be thankful for and grateful for. We just got to keep washing our hands and make sure we're staying that 6 feet away from each other, so that none of us get each other sick, and we all do our part to do proper social distancing and quarantining. And so hopefully the better we are at it, the faster we can get this cloud lifted and get business back to usual. So this is, I'm glad to be able to see you guys again another week. And, I'd say at least for now, we'll be planning on next week visiting again at this time. And any questions you have, certainly feel free to send them in between. We'll make sure we address. But I appreciate the opportunity to spend the last 50 minutes with you. Thank you, everybody.
Bye. Everyone have a good
Bye-bye.
day.